And you talk about changing the world. These are ways that Nebraska is changing the world.
A new vision for the University of Nebraska Medical Center hopes to take healthcare to the next level. The multi-billion-dollar project called NEXT promises new state-of-the-art facilities near Saddle Creek and Farnham. UNMC Chancellor Jeffrey Gold says NEXT will transform hazard response, impacting people not only in the state, but around the world.
Or at a concert or something like that, and where does the capacity for that exist?
Well, simply put, the plan is a game changer. Major piece of the Hazard Preparedness Project is fostering a partnership between military and civilian response units. This means more training in the management of highly infectious illnesses, treatment for people injured by chemical or radiological exposure, care for people impacted by environmental disasters around the country. Now, Dr. Gold is with us now talking about the NEXT project and how it basically impacts not only Nebraska, but around the world. And could this impact, or could this something like this impacted the current quarantine response?
Well, the facilities that we're talking about could have multiple uses. It could be for people who were actively infected, people that were exposed to floods, tornadoes, hurricanes, etc. We've certainly seen a good deal of that across our nation. But also people who could be exposed to various types of viruses or chemical weapons someday, heaven forbid, in other parts of the world. You know, we have American citizens that are deployed either in the military or employed in the civilian forces all around the world that, you know, take all kinds of risks, as we've, you know, recently seen with what's going on in China, that may have to come back to the United States either urgently or emergently and be cared for. And the facilities to do that need to be planned and then built. That's what we're talking about.
Yeah, there's a couple facets of NEXT. Building an academic medical center. I mean, it's the huge building, but also focused on the hazard disaster responses. Why do that? I mean, what is the, I guess, what has been the call to even make this happen?
So that's a really great question, and what I thought I would do is read to you from a recent article that was published in the Journal of the American Medical Association just last week, if you don't mind, and I'll just read one sentence or two. And so this is from an article titled Enhancing Private Sector Health System Preparedness for the 21st Century Threats, and it comes from the National Academies of Medicine, two very prominent authors. And I'm just reading from the conclusions, and it says that at this point, the United States healthcare system is wholly unprepared for a wide range of 21st century health threats. It lacks the will, the coordinative mechanisms, habits of cooperation, governance agreements, and shared resource investments essential to preparedness. Or put it into simple terms, the need has probably never been higher due to what's going on around the world and in this country, and that the preparedness, the capacity to surge in event we're not dealing with 10 or 15, but dealing with 10,000 or 15,000 American citizens to be able to handle that kind of volume.
Now, in UNMC's explanation of the project, it said the NEXT project has deep roots in national defense strategy. Now, taking into consideration what you just read, you're not talking just health, but we're talking national defense. How does that fit in?
Well, it fits in because we have American military deployed around the world. Right. For instance, as we sit here today, there are approximately 25,000 American soldiers in South Korea. And, you know, hopefully they're all healthy and not exposed to any of the recent virus outbreaks. But there is always a possibility of either intentional or unintentional activities. There are chemical spills, there are nuclear power plant injuries, such as, you know, think Fukushima. But there are also, unfortunately, all different types of state and non-state actors out there that may cause enough trouble that we might have to repatriate, bring home to their families for health care large numbers of Americans. And so it plays directly into both the civilian and the Department of Defense needs.
Yeah, bioterrorism has been identified as maybe a leading factor in the next attack, if you will. How does it work? Are we talking just the facility? Where's the facility going to go? How big is it going to be?
Well, we're still working on very preliminary plans, and the specifications from the federal government as to what this might look like are unknown at this time. There's a planning process that's looking at scope, capacity, readiness on a national level. However, we have a goodly amount of space that's on the corner of Saddle Creek and Farnham, just north of the Fred and Pamela Buffett Cancer Center, approximately 7 acres. And currently, we are contemplating something in the vicinity of 2 million square feet.
Would it replace any buildings? Would you change what's happening now at Nebraska Medicine, or would it just be a strict addition?
It would probably replace some of the space that we're currently operating in some of the older facilities on campus. Of course, the Fred and Pamela Buffett Cancer Center is just 2 years old and very functional and state-of-the-art. But we have other buildings that are 50, 55 years of old age that are approaching end of life. And it's not to say we couldn't and shouldn't renovate them, but this is an opportunity to not only meet the needs of our nation, but also to rebuild, to replace some of that older facilities, which can be effectively turned into offices, outpatient space, et cetera.
My understanding, we're looking at a price tag ballpark $2.9 billion. Where's that money going to come from?
With a B, yeah.
Yeah, with a B. Public, private, philanthropic. How much are you looking, or do you expect the public load to be?
Well, as some of the audience may know, that the Nebraska legislature is currently contemplating a bill, LB 1084, which, when triggered with appropriate federal and private investment, would put approximately $300 million over a period of years into this project. We believe that the private philanthropic sector is going to be interested and willing to help us do this. There probably will be some debt service that will be associated with it. And then there are going to be some wraparound services that are not even in that price tag, things like hotels, office buildings, parking structures. You know, I always hear about parking in my daily life. And all of that will wrap around that. And that's probably close to $1 billion worth of infrastructure that will be completely done by the private sector. And so you add all that together, you come up with this price tag in the multi-billion-dollar level.
What's the time frame? When do you hope to cut the ribbon on this thing and open it up?
Well, I think from start to finish, it's probably a 5 to 7 year project, just from the purpose of construction. You know, you think about it, we're talking about 35,000 construction workers over a 7-year period. We're talking about, you know, as I said, nearly 2 million square feet. And I think it'll open in phases. You know, we hopefully will be able to start to break ground just about a year from now, which is actually very soon. Consider the planning that will be necessary, the site preparation that would be necessary to do this. And so we're actively working to assemble the funding sources, but equally importantly to us is we're working very, very hard to understand the federal specifications. In other words, exactly how many square feet, exactly how many beds, clinics, testing labs, et cetera.
Would this complement the biocontainment unit, or would this replace it? Would it be different? It would replace it. And exactly how? What would come in its place?
So this will become what's called an all-hazard facility.
Right.
So the biocontainment unit is aimed at highly infectious diseases. Think Ebola, for instance. But it's not all that well prepared necessarily for complex trauma, burns. It probably would be suited for chemical injuries or radiation injuries. But the idea would be to have a capacity between 500 and 700 beds that could be used for biocontainment, that could be used for burns, trauma, that could be used for chemical injuries or radiation injuries, and sort of mix and match, if you will, so that there'd be a single site destination that would be the preferred place to do this. And you know, if you look at what kicked this off, which is the National Defense Authorization Act of 2020, passed into law last December, it specifies up to 5 of these units across the country. At least 1, but up to 5.
All right. Dr. Gold, thanks so much for being here today. Appreciate it, and good luck.
It's a pleasure and an honor. Thank you.
You bet. Well, coming up, we're going to get an inside look at that quarantine zone in Camp Ashland, one family and its major milestone. You heard us talk about it earlier. They're counting down the days at Camp Ashland. You're watching KETV News Watch 7's Chronicle.